Okay, this video is iron overload and hemochromatosis. This is part 4 of the series on iron overload lectures. Okay, so we'll start out a little bit again, remind ourselves how iron is absorbed. It's absorbed primarily in the duodenum. It then exits the duodenal lining cell called the enterocyte through ferroportin. Ferro means iron, portin means door, so that's the iron door. And typically we absorb 1 to 2 milligrams per day. We typically excrete that same amount. Men excrete 1 milligram per day. Women who are menstruating excrete 2 milligrams per day, which is a very minimal amount. That's why regulation is controlled primarily by absorption. That's the key thing to know. Hepcidin, hep coming from liver, cidin to kill bacteria, because you kill bacteria by depriving them of iron, is produced in the liver, and that will go and block absorption. So if the body has a bacterial infection, the body will suppress that infection by hiding the iron away from it and by decreasing iron absorption. Okay, that's also why you might want to starve a fever, block iron absorption by starving, not eating at that time, to further lower the body iron availability to the invading bacteria, so to speak. And then the iron goes, for making red blood cells, the hemoglobin, and for some other processes. Okay, so again, we talked about men start becoming iron overloaded in their 20s in Western countries. Women don't become iron overloaded typically till after menopause, or if they have a hysterectomy, then they start rapidly catching up with men. And you reach a tipping point where you start to leak iron away from your storage sites, and then it starts becoming free iron and causing problems. Iron overload is associated with lots of problems. One of them that comes up is sperm damage. I think there's a major tons and tons of people have infertility. It's far more common than is widely recognized. I have a lot of women asking me about infertility, and it's pretty obvious what you should do. Avoid excessive iron. All right, that's one thing, but that's not the main point. All these estrogenic chemicals in all the GMO foods, GMO soy sprayed with the Roundup, the glyphosate, the soy itself is estrogenic. The atrazine sprayed on GMO corn, the F minus in the typical municipal water, the tons of endocrine disrupting estrogenic chemicals in water, so you got to have at least a carbon filter for that. And all the endocrine, I have a whole bunch of lectures on this, so I'm not going to go into too much. Typical, a lot of knucklehead guys putting their cell phone in the front pocket, men and women sitting with laptops on their lap. You're just adding up to your infertility risks. Not a smart thing to do. Okay, excess iron is associated with increased risk of cancer, increased risk of heart disease, increased risk of dementia, increased risk of cirrhosis. And the hemochromatosis disease is much more common than is widely thought. It's probably as common out of 1 out of 200 persons based on the results of their lab tests when they go to donate blood, which is much more common than was thought. A lot of other people are carriers. They might be heterozygous, having only one copy. Let's say they got the gene from their mother or from their father, but not from both. So full-blown homozygous is to have the gene from both parents. And they'll often have a transferrin saturation over 60, but to get it from one parent, you're still at increased risk for these diseases, just not as bad or as early of an onset. Real high iron accumulation can damage the pituitary and cause hypogonadism, decreased ability to make your reproductive hormones. Okay, some things that cause iron overload. Of course, heme iron, because that's with the iron in meat. We absorb about 50% of that, which is about 5 times as much iron as we absorb from plants. Plus, when we're iron overloaded, we still keep absorbing it. We can't control it. That's why the meat is dangerous. Red meat is like slow twitch muscle fibers, and that contains about 10 times more iron than does white meat, the fast twitch muscle fibers. White meat is because it's got more glycogen in it for fast twitch. Plant iron is absorbed in the ballpark of 10%. Plus, plant iron, the body's better able to decrease absorption rate when it wants to. It has better control of that. There's a lot of things in plant foods that'll sometimes even further lower the amount of iron that's absorbed, like the phytates in some grains. Some of the problems arise because in the westernized countries like the USA, they've been fortifying the grains relatively heavily in the cereals since 1979. And, like a typical young dummy, I thought that would make me stronger, be like Popeye. And I used to specifically, buy all the Raisin Bran with the extra iron fortification, enrichment, so to speak. So you don't want to do that. That's a stupid thing to do. I didn't know any better back in those days. A lot of people taking Geritol or other vitamins that have extra iron, so-called supplemental iron. Bad idea. You're poisoning yourself. Unless you're anemic and you actually have it prescribed by a doctor and you really need it, most people are getting way too much iron. Vitamin C can increase iron absorption because it reduces it to, so you don't want to do that. Like a stupid meal would be eat red meat and have red wine with iron fortified bread and vitamin C all at the same time. That'll jack up your iron absorption big time. Alcohol also is double bad. It contributes to liver damage, which simultaneously might cause liver cells to die. And then they often store a lot of iron in the liver cells in the ferritin, and they'll release more of it into the blood, so you get more free iron. That's not good. Don't cook on iron cookware like the Bantus in South Africa. They gave themselves very high iron levels from doing that. I used to have some cousins that like to cook on iron. Not a smart thing to do. Things that make you menstruate less if you're a woman will increase your iron levels. If you had a hysterectomy, if you're on birth control pill for decades and decades. So we talked about hereditary hemochromatosis. Heterozygous is the carrier, just getting the gene from one parent. Homozygous, I abbreviated HOZ, that's getting the gene from both parents, so they get sicker sooner. If you got disease that requires repeat blood transfusions like beta thalassemia, Cooley's anemia, more common in Mediterranean areas in Southeast Asia, they often die in their teens or 20s, okay? Homozygous hemochromatosis, they'll often die in their 50s, but if they make the diagnosis soon enough and they get blood donations, they can live normal life expectancy. Okay, some things to be careful about. Well, we're not going to talk too much about supplements here, but there are issues with supplements. You don't want to overdo it. I only take vitamin B12 for what that's worth, and I'm 100% vegan, low-fat, low-sodium vegan. Okay, primary hemochromatosis, some interesting things about it. They'll typically have a transferrin saturation, let's say, over 62%. That's sort of the most sensitive and accurate way to diagnose it. Among healthy donors, about 1 out of 200 has it. Homozygous hemochromatosis, according to Laufer's book. That's Laufer wrote a real good book on iron chemistry. That's Iron in Your Heart. That was sort of the most fun one to read. And it's the best introduction to it. Then you get into all the specialized stuff. Why is hemochromatosis an Irish disease so common? I think it's probably because our ancestors, it was hard for them to acquire enough iron. So being heterozygous in the old days, when it was hard to get enough iron, might have helped you to get more iron. And so that might have been an advantage for that. There's other reasons too. I think there might be some protective effect against malaria or something. I'm not so sure about that. I just seem to recall that. And also the harmful effects occur relatively late after you've reproduced, so there's not going to be as much so-called evolutionary selection for traits that affect a person after they've done their most of their reproducing, so to speak. Okay, these are some characteristic things of hemochromatosis. They'll often develop liver cirrhosis, and that'll often cause them to die. They have a markedly increased risk of cancer of that cirrhosis. You know, it's a bad combination, liver cirrhosis and high iron. Skin pigmentation, the skin becomes bronze-like. So that's why that's also called, and they often have diabetes from pancreas beta cell failure, so it's called bronze diabetes. We talked about pituitary iron infiltration causing hypogonadism and impotence. They'll also get arthritis, heart failure, a lot of bad stuff. And it's easy to treat. Just do therapeutic phlebotomy, blood draws, and they live just as long as anybody else. Okay, here's a paper showing hemochromatosis with phlebotomy had a normal life expectancy if diagnosed and treated early. How to reduce your iron levels. Okay, well, first of all, Jim Moon, he wrote also a very good book about iron. He called it Iron, the Most Toxic Metal. And he said the stupidest thing ever done in the history of nutrition in the United States was to fortify the grains and cereals with iron. And he said the second stupidest thing was to use inorganic iron, which is not bound to anything. And that's a bad form of iron as well. Organic iron means it's bound to some molecule that comes from plants and animals, like with carbon in it. Other things you do to reduce your iron, just eat 100% plants, eat vegan, and avoid the foods that are kind of high in iron. It's rare plant food to have high iron, you know, moderately high with raisins, so to speak. Things with phytates in them tightly bind iron, like wheat bran, rye, and whole wheat products, but make sure they're not enriched with iron. Avoid all processed foods. In general, a lot of processed foods are enriched with iron. That's bad. Avoid the meats, especially liver is the worst, then beef. So anybody tells you liver is a good food, tell them, are they stupid? Look at the high iron in there, okay? Avoid iron cookware. Avoid multivitamins that contain iron. Don't take vitamin C at the same time with a meal that might have high iron in it, because it'll reduce it in the gut and increase absorption of it. Get a water filter that removes iron, like an iron filter for your water, if that's an issue. Exercise more because you'll sweat more and it causes a tiny bit of blood loss from the gut, but the net result is iron will help to lower your serum ferritin when you're exercising a lot. Donate some blood. I did that. I'll do my analysis of my lab results later on, but donating some blood helped me lower my iron, plus just avoiding it and exercising a lot. An aspirin a day, some people think its therapeutic benefit is largely because it causes a little bit of intestinal bleeding. For women, allow normal menstruation. You got to make decisions for yourself. Be careful about getting a hysterectomy at a young age. You stop menstruating, then you take on the same cardiovascular risk as a man. You got to be aware of that and fix your diet and health habits accordingly. Like we said, eat the good foods, plant foods in general, low in iron as long as they're not enriched with it. A bad food would be like red wine, which is high in iron, low in cholesterol, and has alcohol. But a really bad meal would be beef, which is real high in iron, cholesterol, and saturated fat. Okay, we talked about the problem on high iron. You'll get ferrous redox cycling between Fe2 plus and Fe3 plus, and you'll be handing off electrons into the Fenton reaction, making hydroxyl radicals. And those are just like bouncing a super ball in a china shop, breaking all the glass. You're just damaging anything that's in the vicinity of that. Okay, if you want to see the reactions, here's the typical reactions of oxidative stress. Know that these are the good guys in green, superoxide dismutase, and that'll neutralize superoxides that are, in small amounts are routinely produced along the intermitochondrial matrix, but they're easily taken care of. The problem is when free iron is available, then you start running the Fenton reaction, producing hydroxyl radicals, and those are the ones that will trash the intermitochondrial membrane. They'll trash the DNA. So that's the big thing to worry about with oxidative stress. Here's the reactions in the intermitochondria. So here's outer mitochondrial membrane. Here's the intermembranous space. Here's the inner mitochondrial membrane. Here's the electron transport carriers that are progressively more electronegativity, desire to grab an electron when you get to oxygen, the ultimate electron acceptor. You'll occasionally leak some electrons down onto oxygen within the mitochondrial matrix here centrally, and this is called superoxide. It has an unpaired electron in its outer orbital, so that's a free radical. And SOD, superoxide dismutase, is great at neutralizing it. Converts it into hydrogen peroxide, and then catalase or GPX, glutathione peroxidase, will turn it into water. So all of this happens all day long, every day, and our body's great at doing it. The problem is when there's high amounts of free iron available, then you start running the side reaction, Fe for iron, ferrous, and Fe for Fenton. You run the Fenton reaction, you start producing hydroxyl radicals, and then you start initiating lipid peroxidation and trashing these membranes. And this will occur in other locations like in the blood, and it'll just trash whatever's around it. People also with aging will get these brown spots. They're sometimes called liver spots. And they look like giant freckles, really like a big rust spot. And they're associated with having high iron levels. So getting your iron down will help protect you from that. Okay, iron in arthritis. It increases the risk of arthritis. Having high iron levels, high serum ferrums. We talked about it causing sperm damage. So you don't want that. We talked about starving of fever, meaning that you have less iron absorption, and that can help deprive the bacterial that's infecting you of iron and help you to successfully treat it sooner. Okay, when your blood's acidic, it's a little bit more vulnerable to leaking iron. Transfer and can't bind as well to the iron. It's another benefit of an alkaline blood milieu, so to speak. Like that's also has an anti-cancer effect. Liver is the major storage site for iron, so that's why anything that causes liver damage, like alcohol or fatty liver from drinking excessive amounts of high fructose corn syrup and industrially processed foods, or just eating a real high-fat diet and you get a fatty liver, all of that will cause the increased likelihood of having liver cells die, necrose, and then release their iron when they die. Okay, this is just a reminder of how it all works. Duodenum absorption goes through ferroportin. Hepcidin can block ferroportin. If ferroportin's open, it'll drop iron molecules onto transferrin, a little two-person kayak boat, and then transferrin transfers it around the blood to wherever it needs to go, the bone marrow or the liver or wherever else. Transferin's also been called, besides being called a two-person kayak, it's also been called a wheelbarrow. Randall Laufer likes to call it a wheelbarrow. Vernon Louvre likes to call it a kayak. Other people call it different things. This is what you don't want, NTBI, non-transferrin bound iron. That's free iron. That's the stuff that reacts and undergoes ferrous redox cycling and damages things. Normally the red blood cells are cleared in the spleen. That's the spleen it's the red blood cell graveyard. Clears out RBCs at about 120 days because they become stiff from the glycated plasma membrane and also the phosphatidylserine externalization, making it stiffer. And so they get ground up. These little sinusoids are like 3 microns. Normal capillaries Red blood cells about 7 microns, normal capillaries about 5 microns, so it has to deform to go through that. In the spleen, they're even smaller, like 3 microns, and old RBCs just burst. They can't handle it. Here's a ferritin molecule. These can store 4,500 molecules of iron. Okay, we talked about the Bantus in South Africa. They got really high iron overload from cooking on the iron cookware before they learned better. Okay, and that's the end of the part 4 of iron overload, where we talked especially about hemochromatosis.